So, let's refresh, shall we? Exercise is the best tool to keep people healthy. There is no drug that can compare in effectiveness for prevention of health conditions. This is something we all agree on. Our cardiovascular systems respond well to stresses we place upon them through exercise. This does obviously need to be combined with dietary advice and support with healthy lifestyles. If managed in this way, then it is the #1 treatment for heart disease, as well as reducing the risk of type 2 diabetes, obesity, joint pain, cancer, osteoporosis, and a number of other health conditions. In short, exercise is good. People with learning disabilities are 4 times more likely to die from preventable healthcare conditions. The average life expectancy of a person with a learning disability is around 20 years less than the general population. These stats don't even take into account people with associated healthcare conditions. I find it quite shocking that having a difficulty learning and retaining new information has such a drastic impact upon people's health. It's almost as though the healthcare system should be in place to support these people. So, why is exercise not being delivered amongst the aforementioned populations by physiotherapists? As physios working with this client group, we are ideally placed to support people with evidence-based treatment that is justifiable to commission us under the umbrella of physiotherapy. If we stand our ground when it comes to funding decisions, we can help improve people's lives. We focus so much on posture and positioning for all the right reasons, but don't appear to consider that once these comfortable and supportive positions are made, that people may need to move out of them and actually perhaps become uncomfortable through forms of exercise. If you were going to visit your GP and say, "GP, I'm going to sit on my sofa for the next 18 years and not exercise or move," what do you think their advice would be? So why do we accept it for people in wheelchairs with learning disabilities? Now, exercise, in its purest form, is difficult, painful, tiring, and may not always be everybody's most enjoyable way to spend an afternoon. Data from activity trackers showed that in one study, around only 5% of Americans meet the recommended cardiovascular exercise and resistance training guidelines, despite self-reported levels being around 50%. Now, some people with learning disabilities may not be able to understand the benefits of exercise, and so physios can be a great conduit to guided exercise time for this client group. I have the pleasure of working with some organisations committed to promoting exercise amongst people with learning disabilities, and some which are pro-exercise but seemingly at the moment not behind the message of supporting learning disability physios or physios in general to upskill to meet the needs of this user group. Physiotherapists and learning disability physios of the UK, you have a specific understanding of anatomy and the body to be able to support people to be more active. With more support around specialist communication, many of you will be well placed to support people with learning disabilities. Now is not the time to hide when questioned about efficacy of treatment, or to accept that funding has been declined for services or that physios have been made redundant. It is the time to shout out that people with learning disabilities need more support to be active, which will lead to happier, healthier people who live longer lives, and that we are the ones who can deliver it. It will also save the healthcare services money, which is what we know it's all about really anyway. Remember, we're not just working to save days missed from work, we're working to save lives.